All New View. We're celebrating the year of the viewer with a special edition that'll keep you healthy from the inside out.
There are diseases you may not even be aware of that can have a devastating impact on your health. So right now we are finding out the 5 diseases every woman should know about from gastroenterologist and internist at NYU's Langone Medical Center, Dr. Roshini Raj. Welcome.
Thank you.
March is Colon Cancer Awareness Month, and I didn't realize this, but colon cancer, you say, is the 3rd leading cause of death in women.
That's right.
Okay, so why are so many women at risk for this right now?
Colon cancer is absolutely a women's disease. So it's the 3rd leading cause of cancer and the 3rd leading cause of cancer death. It affects women just as much as men. And the good news is it can be preventable because many colon cancers start out as polyps. Polyps are precancerous growths. We have some images up here of what a polyp looks like. And if it's left in after many years, it can grow into a cancer. But if you get screened and the polyp is removed, the polyp's on the left, the cancer's on the right, you'll see that if you remove it, it doesn't have a chance to grow into cancer.
What are the symptoms and warning signs of colon cancer?
Well, it's important everyone knows this. Rectal bleeding, a new change in your bowel habits, so sudden diarrhea or sudden constipation, weight loss, lower abdominal pain.
You say that this disease can be prevented when it's caught in time. So one of our viewers, Jackie, wants to know how early and how often should you get screened?
So it's a great question. Age 50 for most people. If you have no family history or you don't have Crohn's or ulcerative colitis, you start at age 50. But talk to your doctor, because if someone in your family had colon cancer...
Crohn's in our family, so it's saying you should get tested.
Well, yeah, if you personally have Crohn's, you need to get tested much earlier. But if someone in your family had colon polyps...
genetically indicated?
Yes, yeah. And the more relatives you have, the more, you have to get screened.
Another disease that is common with women, hypothyroidism.
Yes.
Talked about a little bit with Brooke. Talk to us about that. Why is it so common? And is it at a certain age?
It's an autoimmune disease that occurs to women most often in their childbearing ages. So that ranges from 15 to 45, but it can occur at any age. And for women, the main one is hypothyroidism. That's an underactive thyroid. So the thyroid's a gland at the base of your neck, and the hormones it produces really governs a lot of our metabolic activities. So if it's not functioning, you're not going to feel well. Some of the symptoms include fatigue, sluggishness, depression, feeling cold all the time.
I had that after my 3rd child, age 30, and everybody said, "Oh, you're a new mom, you're just tired." I said, "No, I'm like really tired."
Yeah.
Like, you have a couple of kids, and so I was diagnosed with both hyper and then hypo. And I have an autoimmune Hashimoto's, which I don't know that led to the thyroid cancer, but it's all very complicated. These symptoms, we have to pay attention to these symptoms.
You do, and women often ignore the fatigue, and they should get their thyroid level checked because it's often the cause
It's
of
a bad feeling.
So now we got a question from our viewer, Kristen. She says her mother has it, her father's family has it, and she wants to know, is this hereditary?
Yes, thyroid disease does have a strong hereditary component, but it's so common anyway that whether or not you have a family history, if you're exhibiting any of those symptoms, you should get checked.
Another thing we hear about, it seems sort of evasive and mysterious, lupus.
Yes.
We're hearing more about it, though, especially with women.
Yes, lupus is an autoimmune disease, and what that means is your body's immune system is mistakenly attacking your own cells. In lupus, the problem is inflammation in different parts of your body. It could be your skin, your joints, but if untreated, it could also lead to severe kidney disease and heart disease. So it can be even fatal if not recognized.
Is there a diagnostic test that you can get for lupus?
Yeah, there are several blood tests. Those are usually the way it's diagnosed, as well as telling the doctor your clinical history. And it is treatable, but it is one of those diseases, again, that often goes undiagnosed because people ignore the fatigue or the joint pain. They think they're just having some muscle aches.
What about GERD? How common is that with women?
Very common. I'm a gastroenterologist, so I see that every day. Gastroesophageal reflux disease, acid reflux. Basically what's happening is you're supposed to have acid in our stomach. It helps digest our food. But when it refluxes or goes backwards up into the esophagus, it can cause pain, burning, as well as inflammation, which when in some cases untreated can go on to esophageal cancer.
Why does it suddenly become, go against gravity? All of a sudden it's coming up. Why?
Great question. There's a sphincter that's supposed to keep everything down. And when your food is sloshing around in the stomach, if that sphincter is not closed properly, it is easy for liquid to come up. So certain foods can relax the sphincter. For certain people, it just doesn't work as well
What
as
are
it
the
should.
symptoms?
So a burning in the chest, what's traditionally known as heartburn, but there are a lot of other symptoms people don't always associate with GERD. A cough very often is due to GERD. Throat clearing, trouble
have that.
swallowing,
I have it.
frequent throat clearing
Why
is
is
a
it
very
that we
common
get these
symptom.
symptoms and nobody does anything about it? You go and you pop a Tums, you have a little bit of heartburn,
Yeah.
you take a little bit of medication.
You know what? Some of the medication that they indicate for this,
Yes.
I've read some of the research, and they say that it can cause bone loss.
Yes, you're right. There is a certain class of drugs, proton pump inhibitors, that can increase your risk of osteoporosis. So I always
You're gonna
do.
to choose if you're a woman then.
Now I'm going to get shorter because I'm trying to control my acid reflux. Please.
Well, there are definitely things you can do in your diet before you go to medication, and you know that includes trying to cut out or at least moderate caffeine, citrus fruits, tomato, wine. Definitely smoking is a no-no.
Things. Anything that has acid.
In the old days.
One thing that we're hearing a lot about is irritable bowel syndrome. Now, I personally think that IBS is BS. A lot of the time I went undiagnosed with celiac because they were telling me I had IBS for 10 years. So sometimes it's a dangerous diagnosis if they don't get to the bottom of it, right?
Well, it's really interesting. IBS, it's definitely a real diagnosis, and it occurs when people have altered bowel movements and abdominal pain or cramping or bloating. But you're right, there's no actual test for it. In medicine, we call it a diagnosis of exclusion, meaning you do have to exclude a lot of other serious diseases before you label someone with IBS, like celiac or Crohn's. But once someone has a diagnosis of IBS, it is treatable, and it is important to seek help. Many women that suffer from IBS don't seek treatment, and yet they're suffering. They're not going out because they don't know when they're going to go to the bathroom, or they feel bloated. It affects their social
That's also
life.
age. I never know when I'm going to have to go to the bathroom.
Just in case.
I drink a thing of water, and it's like if I'm not 10 feet towards the bathroom, I'm wetting my pants.
Sounds like Whoopi needs a potty break, so we're going to give big thanks to Dr. Ashini Raj, and we'll be right back. Scoot out of here, Whoopi!